Thank you very much, Dr. Anders. Can you hear me well? All right. And I guess all these cables means that I had to remain here, right, through the whole conversation. I hope some other presenter brings good news to you, because after Dr. Anders' presentation and after what I'm going to be talking about, I think there's this could get pretty depressing pretty soon. So, well, you know, I am an optimist, and I guess it's the only way you can deal with some of these issues if you at heart believe that there is a way to find a solution to these issues, and that you have the commitment really to use your talents and resources, you know, to promote the well-being of our communities. Before I start, I just want to acknowledge the contribution of the Don't Spout Dalton Foundation, who are the sponsors of the center that I now direct. We just got approved by the Senate about 3 weeks ago, so this is a very new center. And also want to acknowledge the contribution to our center made by Southwest Airlines, who are our official kind of like airline, so to speak. So it's in my contract that I have to say those things. And now, I am very happy to be here today speaking about this issue of domestic violence. I have been in the field for about 20 years, working both as a domestic violence researcher and as an advocate. I have tried to use my position in academia to get at the table in conversations in Washington and everywhere I could to try to at least move the needle a little bit and help our community. So I don't come here as a very objective researcher. I'm a researcher with a mission, and I very much decided early on in my life that this is how I was going to conduct my academic life. Okay. Now, the fact that we're talking here today about domestic violence is kind of like it's interesting to me, and it's also an indication of how far we have gone in the conversation about domestic violence in this nation. When we began talking about this, researching it in earnest about 20, 25 years ago, 30 years ago, most people really didn't want to talk much about this. There wasn't much of a recognition that this was an important concern. It was thought to be something that happened behind closed doors, and for many people that was where it was supposed to remain. Nowadays, the fact that domestic violence, or the idea that domestic violence is an important advocacy, legal, and clinical and research issue can hardly be denied. As we're going to be reviewing later, it is estimated that between 8% and 67% of women around the world are physically assaulted by their intimate partners at some point in their lives, with most countries reporting lifetime prevalence rates of at least 20%. We'll also talk about national estimates that indicate somewhere between 1.3 and 8 million women are physically assaulted by their male partners each year. We all know that domestic violence by now is associated with major depressive episodes, post-traumatic stress disorder, injury, and death in women. Now, concern about the magnitude of the problem in the area of domestic violence and its effects on women's safety and well-being has shaped public policy and led to both significant developments in the criminal justice response to domestic violence. We now have a protective order of injunctions, mandatory arrest laws, intervention programs for men, and coordinated community response initiatives. Now, particular importance for the purpose of our meeting today is that there have been increased calls for the development of a science-based approach to understanding and preventing domestic violence, including the identification of factors for domestic violence as one of the main objectives of this effort. Let's see. Is it supposed to work like this? No. Okay, here we go. Here you go. And suggest perhaps an expanded culturally responsive way, which I think is better suited to study and reduce domestic violence in ethnic minority communities. Let me say, by the way, of the people that are here in the audience, would you mind just raise your hands? How many are you students? Okay. How many of you have worked with domestic violence organizations? Okay. All right. I want to ask how many of you have experienced or know somebody who has experienced domestic violence, because I'm pretty sure I know the answer already. Well, thank you. Thanks for you. Now, let me say a few things about what I mean by when I talk about domestic violence. We know there are terms like family violence, intimate partner violence, partner aggression, partner violence, battering, intimate terrorism, marital violence, spouse abuse, and wife beating are often used to talk about the occurrence of violence in adult couple relationships. For community advocates and human service providers, the term domestic violence is shorthand for patterns of coercive control and domination by men against their female partners, which are achieved through a variety of behaviors such as intimidation, harassment, persecution, verbal aggression, denial of access to resources, sexual coercion and assault, and physical assault and torture. Although this definition, which is so broad, has served well the battered women's movement and advocates working to protect women and to kind of like educate the public about this issue. The operationalization of this construct for research purposes has proven to be a major challenge for the field. Instead, what researchers have done is to focus on specific forms of domestic violence and on the occurrence of physical violence in presumably heterosexual relationships in particular. And I say presumably because although there are more researchers now focusing on domestic violence in same-gender relationships, most researchers and service agencies do not report sexual orientation data from men and their partners. Thus, I just want to make clear that although in this presentation I will be focusing and talking primarily about physical violence perpetrated by men against their female partners, I in no way want to endorse the idea that domestic violence happens only in heterosexual relationships and that other forms of violence do not have devastating effects on victims. Domestic violence typically occurs under a veil of secrecy that makes it very difficult to develop accurate estimates of its prevalence. The situation is true in the United States, and it's even more so in countries with little or no history of promoting and protecting equal rights for women. In order to kind of like evaluate and the extent and seriousness of domestic violence, researchers and government officials often turn to national surveys on intimate partner violence and official records. In the past 15 years, at least one survey on intimate partner violence has been conducted in 71 countries across the world. We now have national domestic violence survey data for more than 40 countries. This data provides abundant evidence that violence against women by their male partners is a common and devastating reality for large numbers of women around the world. Oops. The main sources of information on the incidence and prevalence of violence against women by men across the world are the WHO multi-country study on women's health and domestic violence against women that came out in 2005, the in-depth study on all forms of violence against women presented in 2006 at the General Assembly by the United Nations Secretary General's Office, and the 2007 report published by the Economic Commission for Latin America and the Caribbean on gender violence against women. Recently, a student of mine and I, Michelle Castro is her name, reviewed the incidence and lifetime prevalence of 44 countries across the world for which national estimates were found. As this slide illustrates, we found that between 8% and 67% of women around the world are physically assaulted by their intimate male partners at some point in their lives. More than half of the countries reported lifetime domestic violence prevalence rates of at least 20%. And in all but 4 countries, 10% or more of the women have been victimized by their male partners. We didn't find any region of the world that had an average lifetime domestic violence prevalence rate of less than 13%. In terms of annual incident rates, we found a range from a low of 2% of women in Germany to a high of 27% of women in Zambia. In terms of the domestic violence rates for countries in the 3 American continents and the Caribbean, we found lifetime incident rates ranging from 8% in Canada to 52% in Bolivia. 10 of these countries are reported to have lifetime prevalence rates of domestic violence of at least 20%. And where's Mexico there? In Mexico, we found reported rates of domestic violence lifetime prevalence of 43%. While these data help us see domestic violence as a cultural phenomenon and a human rights issue, we have, I want to warn you, we have to be careful about what do we infer from data drawn from using very diverse methodologies and definitions of domestic violence. The WHO multi-country study was one study that was designed to overcome some of these limitations, relying on standardized assessment instruments and procedures to obtain information from about 24,000 women from 15 sites in 10 countries representing culturally diverse settings. The study was very unique also in its reliance on women's reports of violent acts perpetrated by the male partners against them to generate the prevalence estimates for intimate, physical, and sexual violence. Here you can see the lifetime prevalence of domestic violence by level of severity for all 15 sites in the WHO study. The severity of physical violent acts, the severity of a physical violent act was defined in this study as the likelihood that the act would cause physical injury. Thus, if you were slapped, pushed, shoved, or shoved, you were defined as having experienced moderate physical violence, while if you were hit with a fist, kicked, dragged, threatened with a weapon, or if a weapon was used against you, you were defined as having experienced severe physical violence. The lifetime prevalence rate of domestic violence range in this study from 13% in Japan City. Where's Japan City here? We see Japan. I am in that point in my life when the glasses are good. Yeah, all right. But a confession to make. Now I need different glasses, so that's what you see me doing. So I'm struggling with accepting that reality in my life. So, and 61% in provincial Peru, to 61% in provincial Peru, with most countries falling somewhere between 23% and 49%. Only 3 sites, Thailand City, Serbia, Montenegro, and Japan City reported prevalence rates of less than 25%, while 7 reported prevalence rates of at least 40%. Now, of significance, note here that in 12 of the 15 sites surveyed, women reported experiencing more acts of severe forms of violence than moderate forms of violence. So this is life-threatening forms of violence that are being reported across the world at alarmingly high rates. The take-home message, I guess, is that international and cross-cultural studies of patterns of physical violence against women by male partners suggest not only that women across culture are victimized by their male partners at very high levels, but that cultural factors may be at play, which account for the variable rates in the occurrence of domestic violence across the world. The authors of the WHO report also want to suggest that the data indicates that domestic violence is not inevitable, and that a critical evaluation of and transformation of cultural practices that promote violence against women is needed to protect women and reduce their victimization by their male partners. Now, let's now talk about the occurrence of domestic violence in the United States. Since the first National Family Violence Survey was completed in 1975, at least 7 other national surveys have been done to study the extent and nature of domestic violence in this country. The main sources of data, of national data on the occurrence of physical violence against women by their male partners in this country are the National Violence Against Women Survey and the National Family Violence Survey and National Family Violence Survey, the 1 and 2, conducted by the Family Research Lab in 1975 and 1985. These surveys, which I'm putting together here, they use similar sampling strategies and relied on the conflict tactic scale, which is standard form in the field, to measure acts of intimate partner physical violence. Here you can see the incidence and lifetime prevalent rates obtained through these surveys. According to this data, approximately a quarter of the women in this country are physically assaulted by their male partners, at some point in their relationship. National estimates of the annual rate of domestic violence indicate somewhere between 1.3 and 8 million women are physically assaulted by their partners each year. With respect to comparisons among diverse cultural groups, the data shows that different groups report significantly different rates of domestic violence. From the National Violence Against Women Survey, we noticed that they found that American Indian, Alaskan Native, and Asian Pacific Islander women experienced the highest and lowest lifetime prevalence rates of domestic violence among specific cultural groups, 30.7 and 12.8. The lifetime prevalence rates for African American, Hispanic, and white groups were 26.3, 21.3, and 22.1% in that order. We know that the difference between these three groups were not statistically significant. Now, in terms of annual incidence, the data from the National Family Violence Survey showed that both African American and Hispanic women experience significantly higher rates of domestic violence than white women and women of other cultural backgrounds. Another domestic violence survey that I included here, which used similar methodology and similar instruments, and it also included an oversample of African American and Hispanic respondents, found prevalence rates for black couples to be 2 times higher than that of white couples and 1.3 times higher than the rate for Hispanic couples. Again, there are important reasons not to reach categorical conclusions about the differential rates of domestic violence in diverse cultural groups based on data that is obtained from national surveys. Some of the limitations include language barriers, lack of demonstrated validity of domestic violence measures for specific cultural groups, and reliance on telephone interviews as the main format for data collection. Moreover, all of the surveys that I mentioned so far ignore the diversity within specific cultural groups. This is particularly relevant when considering grouping together responses for ethnic groups with very different histories of religious traditions, cultural identity, gender role expectations, colonization, into broad categories such as Asian, Pacific Islander, Hispanic groups. And even when we lump together black people as a homogeneous group with little or no attention paid to regional differences within the US and other differences between African Americans, African Caribbean, and African blacks. To date, the National Alcohol and Family Life Survey, in which I had the pleasure to be involved with a few years ago, is the only national survey that has been designed to overcome some of these limitations with respect to the study of domestic violence among Hispanics in the US. Data from this survey found annual rates of domestic violence in Puerto Rican, Mexican American, Mexican, Cuban American, and white couples of 20.4 to kind of like 9.9 across the groups. These findings underscore the need for culture-specific research on domestic violence and serve as a warning that combining data from different cultural groups is likely to conceal large differences between groups while overstating the difference between whites and other cultural groups. Now, let's talk now about what we know about the perpetration of domestic violence. Over the years, two main points of consensus have developed among domestic violence researchers. The first is that the perpetration of domestic violence is determined by the interplay of individual, relationship, community, and larger social factors. The second is that domestic violence is not a homogeneous occurrence. The task of discerning which specific variables at each level are associated with an increased risk that men would victimize their female partners has been kind of like the focus of an incredible amount of effort by researchers in the field. What I'll do now is I'll share with you more specifically. We'll go one by one and talk about the specific factors at each level that have been found to be most to increase the probability of violence against women. More than half of all the risk factors endorsed by domestic violence experts are individual level variables. These factors touch on issues related to demographic characteristics, history of aggression against female partners, history in the family of origin, history of violence in the family of origin, psychological functioning and mental health issues, substance use, and what I call restricted worldview. Accordingly, the risk for perpetrating physical violence against female partners increases among young adult males and men with low levels of academic achievement, i.e. those folks who have school dropouts, no high school completion, blue-collar occupational status, and low income. Although most men that experience and witness domestic violence in their families of origins do not go on to abuse their intimate partners, and this you should kind of like, we've gone in the field of domestic violence from not talking about it and not knowing much about it to kind of like a lot of misinformation about domestic violence in the public. So it is, the reality is the majority of the men the majority of us who have witnessed and experienced domestic violence at home do not really grow up to be male batterers. Now, having said that, growing up within this context significantly increases the risk of violence perpetration. The risk also increases among men with what you might describe as somewhat fragile psychological functioning, including men for whom intimate attachments are a source of anxiety, who experience higher than expected levels of anger, depression, fear, jealousy, and stress in their life, who do not feel good about themselves, have rigid and maladaptive cognitive styles, and tend to feel powerless at home. The presence of psychopathology, which has been kind of like the main focus of a large segment of the field in the last decade. In particular, emotional dependency, antisocial, and borderline features, also increases the risk of domestic violence perpetration. In terms of substance use, men who drink heavily and men who use illicit drugs are at considerable higher risk for domestic violence than men who do not. Drinking, and this is an area I don't have a slide about that, but drinking also, some of the analysis that we did with the Latino populations a few years back, the different patterns of drinking are associated with different rates of violence with different Latino groups. Among Mexican Americans, binge drinking is a strong predictor of violence against women, and not so much with other groups. Like in the Puerto Rican community, that binge drinking was not such a dominant way of drinking. They drank the whole week, not all at once. So, I am from Puerto Rico, by the way. So I should have said that to begin with. All right. So it appears that it also appears. Let me see. It also appears that how men make sense of the world around them also affects their risk for perpetrating domestic violence. In particular, we have learned that holding traditional sex roles, expectations, and negative attitudes about women, believing that those of perceived lower authority should obey them, being intolerant of others, and approving the use of physical violence in intimate relationships all increase the risk of violence perpetration by men against their female partners. Let's now look at what I call high-risk relationships. At the relationship level, the risk of domestic violence perpetration increases in relationships that can be characterized by dysfunctional and oppressive dynamics, poor interpersonal skills, and depleted emotional and material resources. In specific, relationships at high risk for domestic violence are those with high levels of conflict, emotional abuse, and verbal aggression, and the presence of male dominance and forced sex. It is also an increased risk of partner aggression, a relationship where the partners have underdeveloped communication and problem-solving skills, and neither other emotional and material resources where to draw from to cope with life. It is an indirect reference to some of the same findings that were mentioned by Anders before about the pervasive poverty and social conditions affecting people's lives. A relatively small number of social correlates are often mentioned by experts in the field as important contributors to the risk of violence perpetrated by men against women. Structurally disadvantaged communities characterized by poverty, low levels of trust, and human resources to draw from when folks are in need, and where adequate sanctions against domestic violence are not implemented, are at high risk for violence perpetration. The risk of violence also increases within broader social and cultural contexts where marked gender and economic inequalities exist, and where the use of violence is seen as a legitimate form of conflict resolution between adults. Now, so there's a lot of factors that you could see, with some empirical support for nearly 40 risk factors for domestic violence. It sure looks, or you would think, that we have learned a lot about domestic violence. That you would think that we're so close to get it done, but have we really? And how useful is this knowledge? This is an issue that as an advocate researcher, I have been dealing with for years, and this is often what I am called to do in the NIH meetings, in the CDC meetings, and someone go in there and say, okay, so why? Why are we doing this? Who is benefiting for this? Do we really know enough about this? What else do we need to know? And I'd like, for now, to raise a couple of questions about, in terms of how useful is this knowledge, and how useful is this knowledge to understand cultural variations in the occurrence of domestic violence. How useful is this knowledge to understand and prevent re-abuse of women and to prevent domestic violence? These are important questions for advocates, policymakers, practitioners, and women who are victims of domestic violence. And we're all trying to attempt to make sense of the literature, find some guidance for this. The reality, however, is that after 3 decades of research, we cannot speak with confidence about what are the relative strengths of risk factors for domestic violence and about how most of these factors relate to each other. The best we seem to be able to do at this point is to say that there is more evidence about the strength of individual and relationship factors for violence perpetration than there is for community and social factors. However, a few comprehensive meta-analytic reviews of this literature suggest that report that small to more. There have been a number of meta-analytic reviews that have looked at all the factors that I review here, and even though there's a large number of them, what they have found is really relatively small effect sizes for all of these factors. There is some evidence of a cumulative effect, that the more of these factors you have, kind of like a dosage effect, that the more of these factors you have, the greater the risk of violence perpetration. But the evidence is not that strong, and the studies have not been done that well. For both pragmatic and theoretical reasons, studies of risk for violence perpetration have typically focused on a selected number of correlates assessed at a given point in time. This is a strategy that has favored the examination of individual variables over more overarching, multivariate, developmentally sensitive evaluation of potential risk factors. As a result, in spite of the field's long-stated preference for systemic and ecologic accounts of domestic violence, relatively little is known about the combined effects of risk factors, about how multiple factors influence each other, and about the effect of risk, and about how influence each other and affect the risk of violence prevention, and about how the potency and the clustering of risk may vary over time and over developmental periods. With regards to the issue of cultural variations in the occurrence of domestic violence, research on risk factors for violence perpetration has focused almost exclusively on what I had called before, generic risk factors, assuming that understanding the domestic that a basic understanding of domestic violence would be applicable across ethnic and cultural groups. However, as we saw before, international, cross-cultural, and national data shows considerable variability in domestic violence rates across countries and ethnic groups, suggesting in part that there may be important cultural specific variables affecting the risk of violence perpetration. Unfortunately, the accurate assessment of risk factors across ethnic and cultural groups is, as you might imagine, a challenging task. We have to deal with the language and literacy barriers, measures that have not been adequately validated for use with the specific group, and with the grouping together of responses from ethnic groups with different histories of colonization, religious traditions, cultural identity, gender role expectations, and so on. I'm going to have to take can you come in here? There are a couple of slides that are in there that I need to get up. Okay. Somehow it's not a. I noticed it was not. Yeah, I knew it last night that I was having the machine was misbehaving, so it's kind of like a. This is, yep, you can leave it there. We'll get to this now. But to date, the National Alcohol Family Life Survey, which I mentioned before, is the only survey that has been designed to correct some of these limitations. A few years ago, I used this data, and the slide is not there now, to evaluate the unique and combined contributions. Disregard this for the moment. This comes later, but. I used this data to evaluate the unique and combined contributions of 11 empirically supported individual relationship and social factors in the prediction of domestic violence among Puerto Rican, Mexican, Mexican-American, and Anglo-American groups. What we found at the time was considerable variability both in the extent to which the various risk factors were present across ethnic groups and in the combinations of the risk factors affected the risk of violence perpetration for specific ethnic groups. A high level of conflict in the relationship was the strongest and most stable contributor to the risk of violence perpetration across ethnic groups. In terms of difference among the ethnic groups, we found that the risk of violence perpetration was higher for Mexican men who had experienced violence in the families of origin. So for them, this carried a lot more weight than for other Latino groups. Mexican-American men with low economic resources seem to have higher risk, albeit a higher risk of domestic violence, and Anglo-American men who had witnessed domestic violence in their family of origins also had significant risk of violence perpetration. Now, the current state of affairs is a somber warning for those of us who believe that science can be used effectively to protect victims and end domestic violence. However, this is not news for many domestic violence researchers. Similar conclusions about the utility of domestic violence research to prevent violence, protect women, and understand cultural variations have been consistently voiced over the past 3 decades. And they're typically followed by recommendations, reasonable recommendations to engage in longitudinal research, to study the developmental trajectory of domestic violence, generate clear definitions of terms to be used by researchers and practitioners, improve the reliability and validity of research instruments with guidance from the specific ethnic groups, rely both on qualitative and quantitative methods to study the convergence of factors such as race, ethnicity, socioeconomic status, age, and sexual orientation, etc. To be fair, and this is where this comes, we all know considerably more today about the perpetration of domestic violence than we did 30 years ago. Moreover, there are reductions in the rates of domestic violence and intimate violence homicides, as noted here, that give us reason to be optimistic about the contribution of risk factors studies to the reduction and prevention of domestic violence. And I pulled this one, this is an illustration of the decline as reported by the Bureau of Justice, a decline on non-fatal victimization, intimate partner violence. Since 1992, which was the first time they measured this, to 2004. And there's a significant decline of 68%. So our lack, the lack of specificity and utility of our knowledge, or at least as generated by research, doesn't match really the movement that we have seen socially. Thank God we haven't waited for researchers to figure it out. We have kind of like continued to do our thing and work in the communities, provide the services, innovating how we make our men accountable for their behavior, institute laws, and that kind of like control their behavior, protect the women, and collectively a lot of those factors seem to be working, okay? But not necessarily because they're heavily founded on research knowledge, is the point that I'm making to you. Now, although the current state of affairs is part of the result of methodological deficiencies, which I have no doubt will continue to improve by a new generation of researchers like you. I believe that our limitations are not all technical in nature, but that they require a more expansive research framework, akin to the strength-based, ecological-oriented approaches to research that may be familiar to you and that are currently used in the fields of public health and psychology. So some of the things that to you may be old news are pretty good news, are pretty recent news in the field of domestic violence. I think that the understanding of domestic violence in general, and including issues related to cultural variations, and the prevention of domestic violence can be significantly enhanced by integrating the assessment of specific protective and wellness promotion factors in domestic violence research, evaluating their relationship to non-risk factors and determining the extent to which they reduce the potency of risk factors for domestic violence perpetration. Unlike the prevailing ecological view for domestic violence perpetration, which assumes low and high levels of risk factors to be causally related to kind of like a positive or negative outcomes, either well-being or nonviolent relationships or being kind of like abusive behavior. I believe we would be better, we would do better by approaching the development of positive and negative outcomes in reference to the presence of risk factors in interaction with protective factors, both at the individual, relational, and collective levels, within specific health and wellness promoting contexts. Also, unlike the preference in domestic violence risk studies to focus on effects of generic and static risk factors, I believe that we cannot wait anymore to include a wider range of cultural specific and dynamic factors that may affect the continuity and discontinuity of violence over time. Within this context, I believe it is reasonable to assume that partners in intimate relationships are affected in uneven ways by both conditions that increase the risk of violence and by countervailing protective and behavioral change factors, neutralizing the risk of factors and promoting their well-being. Here you can see in this diagram how risk and protective factors can both be included in an expanded ecological framework for domestic violence perpetration. Included here are some of the factors that I mentioned before that have been noted by the domestic violence literature, the domestic violence researchers to be related with an increased risk of domestic violence perpetration. And a whole set of variables noted by psychologists, criminologists, sociologists, community psychologists, public health researchers, to be associated with either wellness or with the change of maladaptive or criminal behavior, and which I think we ought to be considering including in a model to prevent as potential factors that may help in the prevention of domestic violence and the elimination of domestic violence. The proposed expanded framework, this idea, demands that people in the field of domestic violence keep in check our preference to account for the trajectory from risk to pathology at the expense of focusing on what needs to be done to protect women, prevent violence, and promote favorable conditions for personal, relational, and community well-being in diverse cultural settings. A culture is a very creative mechanism of survival. Culture gives us the memos on how to stick around longer and longer and pass our traditions to others who will come next. But we insist in trivialize our look at when we look at cultural differences as a control variable or as an identity factor, we missed, or only in that way, we miss kind of like looking at all these other ways in which cultures really play a significant role in promoting well-being in our lives. I think that this is a direction, if we want to really learn more about cultural variations in domestic violence, we need to not abandon the search for risk factors, but understand the presence and potency of these factors in reference to what is happening well. Dr. Anders talked about the Hispanic paradox, I think the word that we used, and how in some variables that doesn't seem to be, it's not happening. The mortality, was it mortality that you mentioned? The mortality rates are not as what's the mortality? Infant mortality rate are not as high as you would expect given other things. Clearly there are cultural mechanisms, cultural factors playing out in significant ways, strengthening the ways in which our communities got on with the business of staying alive and living life worth living. And we need to include those, especially, if we're going to make sense of this, we need to include make a much closer look, take a much closer look to the factors on this end. Without that, we will never really get clarity about what is it that in what ways particular factors are affecting the risk of victimization for women. And not only that, in the design of interventions for our communities, this is where culturally appropriate and specific characteristics are found. This is what we need to avoid from getting to happen, but this is where would teach us the direction to follow. All right? So thank you, and if you have any questions, just let me know. You can send me my contact information. You have we have a few minutes for questions. Yes?
I have a couple of questions.
Sure. Yes.
Some years ago, Jonathan Mann created the Institute for Human Health and Human Rights at Harvard based on his notion, and I think a true one, that violence against women was one of the most important perpetrators of HIV in many parts of the world.
Mm-hmm.
I've seen other data to show that it also is important for STDs. And also, when we looked at family violence in Pakistan,
Okay.
we found that it was associated with a huge level of depression,
Yes.
particularly in women.
And women. Yeah.
So that's one question. And do we have those kinds of data? Do we know anything about that in the U.S.? My second question is, I really am surprised not to see anything about education,
Mm-hmm.
levels of education and their relationship with family violence.
Mm-hmm.
And I would ask the same question that I will ask in my own talk this afternoon. What's the equivalent of a year of education in terms of reduction or change in family violence? Because I'd be very surprised if education doesn't play an important role in family violence.
Let me take that question first because I have a good memory, but it's short, so I remember that one. I'll go to the other. Education has been. Keep in mind that criminologists and sociologists were really the pioneer researchers in the field of domestic violence. So they have looked at education, believe me, in many, 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 many ways, and it simply doesn't show up. It is as a correlate of other kind of like socioeconomic conditions, poverty, living in structurally kind of like a deficient community, so on, is correlated with that. But a main effect, if you will, for education has not been found to be a main contributor. Now that is from the research end. From the clinical end, which is what I didn't say anything in this talk about the clinical knowledge about this, because that would require a whole different other sets of conversation. People would in fact tell you at the clinical end that it matters, what people, that it matters the strategies that they have to approach learning and to what they know about this in general, but there just simply isn't. I don't have any other explanation. There simply isn't much in there. Now, the first question, what was it?
The relationship between
HIV and
STDs and even depression and family violence.
for years, the domestic violence researchers played, and I think with the assistance of the federal agencies, played kind of like a strange game of, on the one hand, acknowledging that you couldn't really talk about domestic violence without talking about sexual assault and HIV, etc. And on the one hand, and on the other hand, of not funding and not making it kind of like a priority in the research. So, frankly, I think everybody would agree with you that it's important, it's related, but it's not something that I know we have hard data on. So it's an area, it's a dissertation area for anybody here, if there is one. Okay. Yes.
In the statistics you have, does it show of non-documented abuses?
Non.
That are abused?
You mean abuses among undocumented people or among immigrants? If you can imagine, I actually had a section intended to cover some of the things. If we know, so I made the point about how little we know about cultural variations and the different subgroups. We know even less about immigrant communities. For some reasons are very easy to predict. It's hard to really get access to them. It's hard to find reliable data at that end. We do have some proxy data that suggests that it's very high. The rates are high and perhaps higher. Because if you look at the rates of fatalities, and murders and among our immigrant communities, then it would suggest that it would be unlikely to find similar patterns within the family. So that suggests to us that, yeah, that is out there. But again, it's something that we don't have hard data on. From at the clinical end, you probably do. Those of you who are here, who are in the field, probably do know among the communities that you work how prevalent it is. But from a research point of view, there isn't. If you're out there in communities that deal with immigrants, which I'm sure you are, this is another wonderful area for you to kind of like help us learn more about the experience of immigrant women related to domestic violence, the resources that are used or not used for them, the rates of victimization, the consequences of it, the utilization of services. It's a field that is there just waiting for people to investigate. Yes?
Are you aware of any programs that have been particularly effective in reducing reabuse or
Program, there is a range of interventions that have been developed over the years to curtail, if you will, the occurrence of violence, domestic violence. Most happen within the criminal justice system. So we have the battery intervention programs, the probation orders, arrest policies, and so on. There is each of those interventions, when you look at the data on their effectiveness, there appears to be about close to two-thirds of the folks who are touched by those interventions for whom that works. So it's almost is eerily consistent. About two-thirds of the men in battery intervention programs, about two-thirds of the men who get probation orders, about two-thirds of the men who are kind of like are arrested and so on. So the system is working for a large segment of the population. Now, we do know that the system is doing almost nothing for the most violent perpetrators of domestic violence. About 10% of the men account for 90% of the injuries to women. So when we talked about domestic violence, we're not really talking about, we don't have an appropriate way yet to talk about this. We have a smaller group of men who are really being very destructive to their partners and that are really a public policy nightmare for the rest of us, if you will. And I mean, not to say for the women who are kind of like they're victimizing. So it's for that 10%, we haven't found that much that really works. We haven't invested too much effort on preventive initiatives yet to know the extent to which they can be helpful. And we do know, however, that when you have when you have communities that understand that the elimination of domestic violence is not an individual achievement, but it's a community achievement. When you have communities that work in what we call coordinated community response initiatives, where they really create adequate forms of communication. Does that mean that I'm done? Yeah. Adequate forms of communication and kind of like share of information and coordination, that those communities have significant reductions in the rates and the occurrence of violence over those that do not have that. So I encourage you, all of you who are here, the way to do this is through coordinated community response initiatives. Okay. Thank you.